Thank you. Welcome everybody to this session, The Patient's Point of View. I am Dr. Vendrell from Catalonia. And first of all, I hope that everybody is keeping well in this terrible pandemic we are all suffering from, which I'm afraid hasn't allowed us to meet all together for this conference. Along with the very interesting lectures on the most recent progress in studying bronchiectasis in this conference, we also have the opportunity to listen to the patients, the final receptors of the research, to hear their views of the disease, what they think about treatments, and what they think about the care we offer to them. We have two speakers from Girona who will each have 15 minutes for their presentations. After this, I will have the opportunity to ask them some questions. I'm afraid that this format doesn't let us to take questions from you all live, but we would be very happy to receive your own questions and comments through the platform, and we will post the speakers' replies as soon as possible. So it's my pleasure to introduce Mrs. Pascual, who will speak to us about her experience with bronchiectasis that she has suffered since childhood.
Hello, my name is Constança Pascual Molinas. I'm from Girona, Spain, and I was born in October 90s, so I just turned 40 this year. Well, for me, the diagnosis was when I was very young, and it was actually my grandmother who acknowledged it, and well, she thought something was wrong because she noticed that when I sleep, she could hear some whistling. From there, my parents took me to various doctors, so I had an X-ray test that showed that I had an opaque midlobe of the right lung. So then I had a test of my sputum in which they found coccobacillus. Therefore, I was prescribed a treatment of tuberculosis for 9 months at the age of 4. And that's how far my memory grows from having bronchiectasis. I can remember even taking the pills of the tuberculosis treatment. They were orange and they were really big for a 4-year-old kid. And that's when I started dealing with bronchiectasis. As a result of that, in 1985, when I was 5, I had to undergo a bronchography at the Vendrell hospital. That I believe it was the last one or one of the last ones to be performed in Spain. And as a result of that, it showed that I had bronchiectasis in both lungs and more in the left one than in the right one that we had seen in the X-ray. Some years later, I had my life I had very many periods of being ill, but some years later, I think I was like 8, I had pneumonia. And I do remember being a whole week in the bed with high temperature and feeling weak and ill, but I don't remember being so much painful than any other breath condition that I had before. Well, I wanted to tell you that my perception of the bronchiectasis in my personal life. So during my childhood and my teens, I was ill a lot. I was sick every now and then, more often than other kids. I have two sisters, and I remember missing or being in bed more than they were. I can recall really skipping classes or missing any subject or activity in particular, but I do feel that I was more ill and not as healthy as other kids. Whereas in my adult life, I have been very normal. I've worked normally, not missing many days or not more than other mates. I even worked in Poland in very icy month, which for me, for being from a hot country, it could have been a shock for my body, but I was very well because it was like very mainly winter, and I've been able to do sports anytime I wanted, to travel anywhere. And also, being a mother on the age of 36, which it had already a risk of being an old mother, so bronchiectasis hasn't stopped me from that. And I wanted to talk to you from motherhood because I do feel that bronchiectasis hasn't affected my maternity at all. Otherwise, it has helped me to improve my immunologic system. During my pregnancy, I was really fine until the last month, where I was already very well. I had a big baby inside, and I had some dyspnea. And also, my child came fit first, so I had to have a cesarean. And in the operation room where they turned to try to turn my baby, I had a cold, so that meant that after the cesarean, I was ill and I had a kind of a flu, so I had to cough a lot, and that was extremely painful, and it reduced a lot my lung capacity. So I had the bronchospasm, which I luckily recovered because the doctors were very fast, nurses. So I had to have some oxygen and some treatment for that. I wanted also to tell you that for someone that has had bronchiectasis all their lives, having a sputum around their mouth, around their body, is something normal. And for me, it was very shocking when I went to doctors and they told me that don't worry about the sputums or the mucuses, the baby will swallow it. You don't have to be more aware than other things because it's normal. Because for me, it was already normal. So it was really shocking that it was something to be pointed out, like if other parents were afraid of mucus or were it was not natural for them. And I think this ugliness of the mucus, it's something that everyone shares, but for me it's something that it's normal, it's there, and I have to deal with it. Something else I wanted to point it out is this: since I had bronchiectasis from my birth, more or less, I can say, well, since I was 3 years old, I've tried lots of different treatments, ones being more successful than others. Apart from having my antibiotics every time that I had an infection or that I needed them, I tried clapping for around maybe 1 or 2 years. I remember perfectly my parents every night clapping in my back, and well, we sang songs. I mean, it was something that it resulted not to be so useful as it thought it was. It was, but I didn't mind doing it. Then for a time I had inhaled acetylcysteine. I don't know if I said the right the name in English, sorry. That I remember not being so nice, but it was really good for my lungs, for that period. I've had breathing and airway clearance techniques. I've been doing them for several years now. I had 2 different monitors to help me with this in 2 different ways of prosthetic of approaching them, and they both went really well. The only problem for me with those is that since I have a kid, it's sometimes difficult to find a space or a place to do it. Then I've been with inhaled tobramycin for about a year, and it helped me a lot. So I don't need it anymore for now on. So I'm pretty good with it. As I've been asked, I wanted to point out the key factors for the patients from my point of view, of course. One is early detection. In my case, it was crucial to control the evolution of my bronchiectasis, because it was I was caught in a very young stage, and when I was very young, and that helped a lot. I was very lucky that my father is a doctor, so he could help me get through it a lot. But I think for other patients, and as a mother, I think pediatricians should explain better to parents what bronchiectasis is and what they have to do when they hear, or if they hear wheezing, and to be aware of hearing it, to check out if the child has it or not, and then take them to the pediatrician and see if it's only one infection from that time or if it's something else. Also, fast access to doctors, it's very important in treatment. How the system is in Spain, for many patients, it's very difficult to get to the treatment because they have to go to the doctors, they gotta get to the doctor appointment, either specialist or not. But in my case, I've lived in Barcelona for so many years, but I kept my doctors in Girona because they had all the knowledge of my illness. They had everything that I needed. My parents were there, and it was easier for me to keep them in Girona. So I've been emailing with my doctor for some years now, and it helped a lot to get to fast treatment. So I didn't have to go to the hospital and wait in the waiting room, see when they have an appointment, go to agencies. So it helped a lot. I really hope with this current situation that in many countries the e-treatments have been developed a lot, and I hope these tools are maintained and help people to get their treatment faster. I understand that for new illness or short period illness, it's not likely because people would like a doctor to see them, and it can be frustrating that someone calls you on the phone and you say, yeah, you have this, and they haven't even seen you. But for all treatments or chronic illnesses, it's good that it's faster, and it's you just have to write an email or ask for your bills, and you don't need to go to the hospitals. And even that, it helps reduce admissions at the hospitals and the risk to infect other other patients or to be infected by other patients, both. Another factor that I think is important is the diffusion and the spread of the knowledge of bronchiectasis. I think it would be very useful to explain what bronchiectasis means and its effects to the patient and their relations, and also not only to this family and the patient, but also to people who deal with people with bronchiectasis. In my case, for example, I would have it would have been very helpful for me for my personal life that my gym teachers and the people who saw me in motion, in stress, knew that I had bronchiectasis and how to deal with me. Because I could do the gyms and all the stuff the same as my colleagues, but maybe I couldn't do with intensity or with the same ratio that them, because my lung capacity is not the same. So I can run the same, I can jump the same, I can do everything the same, but maybe not with the same intensity. And it would have helped me a lot in my personal life, not to be seen as a weak one, as someone who can't, she gets tired, she gets whatever. When for that early ages, I think it's really important for the kids to be supported, not to be, bullied in this sense. Personally, I've never been given a brochure or book to read about my condition. It hasn't been really a deal for me because my father is, as I told you, my father is a doctor, and I have access to my doctors who can explain me about it fast and anything I need to know, or I can check the internet. But I am sure many people do not have these facilities or do not know how to find this information. So I guess, for example, everyone that had asthma or cystic fibrosis, you more or less know about it, you've heard about it, but not many people have heard about bronchiectasis and what it means. So it's important to make a better diffusion, a better information about bronchiectasis, and that you hear more often about it. So people know that there is something about your breathing that it's not okay, and maybe this way it won't pressure you too much. Another one of the factors for me is the maternity, as I think some people who have bronchiectasis may be afraid that the whole labor, the whole being pregnant bronchiectasis can affect and their health. But for me, it's not been an impediment being a mother. Moreover, I think bearing my child has helped me or helped my immune system to be stronger. And I can assure none of the viruses that my son has caught in school have affected me at all. And it's really nice. So yeah, as I said before, I had to bronchospasm after giving birth to my son, and that was really it was hard. It was terrifying not to being able to regain my breath again. I had to be given oxygen and intravenous corticoid and inhaled bronchodilator. But I was very lucky that the doctors and the nurses were very fast, and they treat me. Their response was really, really good. So that was the main thing that I had from giving birth or maternity. The rest, it's really been positive, and I think this needs to be told to other patients that not to be afraid of getting pregnant, and because the disease is not going to prevent from them to do anything. Another key factor that I wanted to talk is environment. I've always noticed it that the environment did affect my condition, but since the COVID situation, I ensured it. I left Barcelona and I started living in the countryside and quite isolated. I was in the mountains for a period of time, and in the Pyrenees, and it was snow, and it was snowing and cold, and I mean, not that anyone can live there, but for me it was a different weather and a different sensation for my body. But it really helped not being in the city with the pollution and not having to take the metro or the bus with crowded of people. And I didn't have any episode during the whole confinement. In summer, my kid went to summer camp. Now he's going to school, and I haven't had any mucus or sputum since I left Barcelona. And when I left it, I was ill. And my partner, who's asthmatic, was also. We had a lot of mucus. We had a lot of cold. It was something different from the normal thing. So it was harder, and it took quite a lot to get rid of the mucus and all. But since then, we've been very well, and it's not only being isolated from other people, but it's also not having the pollution and the negative health, the negative effects of being in a big city. It has helped us a lot. Finally, I wanted to show you how in my everyday life is. So bronchiectasis hasn't stopped me from doing anything. And even though I've been sick and I have been a lower lung capacity, I've been able to do everything I wanted to. I've traveled the world. I've been in countries like India or wherever, and I had no problem with my disease. I like trekking, and I've been able to do some trekking since I was a kid. I love cycling, and my partner is a very good cyclist, so we take the bike very often. For me, it's like my safe sport, because I feel very safe with cycling or swimming also, and I've done anything I wanted. I've also climbed mountains, and even though I've noticed that I get tired very soon, when I start walking or exercising, 5-10 minutes doing it, I feel that my lungs don't respond, that I get tired, that they hurt. but I know that I get like a dry mouth and a dry sore, and my neck sometimes hurts. But I know that if I stop and I catch my breath, I drink some water, then I can go on and I can do whatever. I can climb mountains, but I do have to stop for a while after, I don't know, maybe 5-10 minutes to exercise. I need to stop, just recatch my breath, drink some water to help clear my mouth and my neck. And then I can go on with no problem. It took me some time to understand that, so it would have helped me someone by my side saying when I was a kid, hey, this is normal, you just have to stop, and then you will be able to. It has taken me a while, but you know, I can, and there is no problem. From a young age, I have been taking any treatments and pills, and mostly were 3 or 4 times a day medicines, and that was a bit of an issue, because if you want to travel or do anything, you have to be thinking, hey, I have to take my medicine, I have to take my pills, I have to stop and do it, otherwise the treatment won't be effective. And even though it's easy to get used to it when you have a routine, when you it is you know, you have to stop whatever you're doing to do it. So I think a treatment of less days, like 1 or 2, 1 a day, 2 a days treatment, take treatment, it would help patients to go on with their life, with the everyday things, not to having to stop and think. And mainly for teens, you know, if you go out with your friends and you are doing whatever, and you have to say, hey, stop for a minute, or I have to go back to get my things to take my pill. It does, you know, it's kind of, oh, again, we have to stop it, because it's something you do every day. It's not like, yeah, it's once that you have to stop and then, but if you are out on a trip, for example, and every day you have to be counting on when you have to take the medicine and all, it just helps that nowadays I know that there are treatments from 1 or 2 takes a day, and it would be nice to keep on going that direction. Also, it's difficult to find a time or a place to take inhaled medicines while you're traveling, or even at home if you have a kid. Because, you know, if the kid wants to come in and whatever, you need a space, not and a time where the kid is not there, and where you can be alone and do the treatment, and then clear the air of the room. And so it's quite difficult, but it's possible. I've always found a way to do it, even if it's later, sooner, rescheduling. I've traveled a lot because my partner is from England, so I've gone to England to my partner's parents' house, and I also found there a place to do it without any problem. But I wanted to point it out that it can be very difficult for the patient to find a place and a time, space to do it. And that is all from me. Thank you very much for having me and for hearing out the patients.
Thank you very much, Constança, for your presentation. Let's now move on to the next speaker. It's my pleasure to present Dr. Massaguer. She's a patient and she is also a doctor, and she will tell us about her experience in bronchiectasis and non-tuberculous mycobacteria.
Thank you very much for the opportunity to participate in this conference. Let me introduce myself. My name is Aurora and I'm 71 years old. I'm a doctor and I have worked for almost 40 years as a general practitioner in the public health system of Spain. Being sick is always a bad experience, and if the illness has an insidious course and it's not very well known, at least it was an unusual illness when I started being sick, the experience is a bit worse. Nevertheless, I must recognize that the illness helped me in being more empathic, comprehensive, and patient with my patients. In some way, it helped me being a better doctor. The first symptoms appeared around 30 years ago, at the beginning of the 90s, with some episodes of fever, cough, and sputum production that became more frequent and more severe as time went by. The X-rays showed that the median lobe was affected. The tuberculin test was weakly positive, but both the Ziehl-Neelsen stain and the cultures were negative. The diagnosis was the middle lobe syndrome, and treatment for tuberculosis was prescribed for 6 months. In the subsequent years, the clinical symptoms continued. The CT scan showed that the middle lobe was practically destroyed and that there were some small bronchiectasis in the upper and lower lobes. Finally, in 1997, it was decided to remove my middle lobe. In the culture of the extracted piece grows Mycobacterium avium. At that moment, it was not considered clinically significant, given that the Mycobacterium avium is an environmental organism and doctors didn't believe it could cause any disease, except on immunodeficient patients, and that was not my case. It was not until 1 year later that I got in touch with my current doctor, who had studied the behavior of those mycobacterium in patients with bronchiectasis, and who understood me perfectly when I explained that I wasn't feeling well, and that I had muscle and joint pain and an extreme fatigue that affected my personal and working life. Because at first sight, all these symptoms seemed exaggerated for the lung damage and the functional limitation that the radiological and functional tests were showing. Leaving aside the treatment with antibiotics of the superinfections caused by other organisms, including Pseudomonas, I have done specific treatments for the Mycobacterium in 4 occasions. In my particular case, and I think for most patients who have done these kind of treatments, the side effects were more important and hard to bear, even more considering its length. Nausea, gastrointestinal troubles, arthromyalgia, fatigue, headache, difficulty of concentration, unsteadiness feeling, etc. During every treatment that I did, I had to stop working and ask for a sick leave permit. In one occasion, I decided to stop treatment on my own initiative because after 8 months of treatment, the culture came out positive, and I could not put up with the treatment anymore. In other occasions, I had to stop treatment because, most likely due to the rifabutin, I presented an episode of fever and leukopenia that required hospital admission. I was able to complete the 3rd treatment for a period of 18 months, but sometime after finishing it, Mycobacterium avium grows again in the cultures. 8 months ago, I started again a new treatment because clinical symptoms were getting worse, with increasing cough and sputum production and with some hemoptysis. The Ziehl-Neelsen stain was positive, and in the culture's growth, Mycobacterium avium and Mycobacterium kansasi. So far, the sputum production and hemoptysis have disappeared, and I now feel better. In my opinion, it is crucial to have full confidence in your doctor, and that the doctor knows that this is like this. In such a hard disease, and with an even more hard treatment, if this relationship of mutual trust does not exist, it is impossible to achieve satisfactory results. In my case, after more than 20 years, I can assure that my trust in my doctor is complete, and I know that no matter what happens, my doctor will devote all the efforts and knowledge in doing what is best for me and for all of the other patients. However, chronic illnesses are hard, and I know that when I gave up my treatment a few years ago, my doctor took it badly, as a lack of confidence, or as if I didn't value her interest in my health and well-being. Me, on my side, I had the feeling that the suffering involved in a treatment like that was not well understood by my doctor, together with a misperception of not being brave enough to carry on with it. It took us a while to talk about it calmly and to restore our relationship. What I mean with all this is that real patients are usually not the ones that appear on movies, always optimistic and courageous, or in worst case scenario, resigned. We have moments of anger, fear, and uncertainty, and sometimes we just want to give up on everything. Even if we have great trust and fondness in our doctor, sometimes we just cannot bear it anymore. This is why I think it would be extremely useful to have, as some of the oncology units do, a psychological support unit, not only for patients like me, but also for everyone with a chronic disease who needs to follow a long-term treatment with important and hard side effects. Nowadays, and in my opinion, there are more questions than certainties. The fact that bronchiectasis have such different etiology makes things even more difficult. What was first, the Mycobacterium or the bronchiectasis? If it was the Mycobacterium, how did it settle in a healthy lung? Or was there a previous inflammatory state? If that were the case, could it be detected? Is there any genetic factor that makes a patient more susceptible to this disease? Could the infection by Mycobacterium be prevented? How? There are so many questions that finding an only satisfactory answer to all of them or to a majority of them is very unlikely. Hopefully, the future will bring us the solution.
Okay, thank you. Thank you very much, Aurora, for your presentation. I'm afraid that a lot of research is still needed to answer all your questions. Both of you have addressed some important issues that healthcare workers should take into account. You have pointed out the importance of increasing awareness of the disease in order to help early detection of it. Aurora, when your first symptoms began, were you familiar with NTM and bronchiectasis?
Of course not. At that time, bronchiectasis were poorly understood, but the causes are under treatment. Moreover, the diagnoses were more difficult because the radiological exploration did not show the images with the same accuracy as today. It was accepted that patients with bronchiectasis were most susceptible to the bronchial infections or pneumonia, but not that they were susceptible to environmental mycobacterial infection. In fact, no one believed that these microorganisms could cause any pathology.
You talk about offering psychological support. Do you think that it could help to include psychologics in bronchiectasis unit?
Yes, indeed. Bronchiectasis and NTM disease are a very hard chronic disease. The treatment is long and has significant side effects. And when you start it, you can be sure if it will be completely effective. Due to its length and its painful side effects, you can be tempted many times to give up the treatment. This is why I find it useful to have a psychological support unit that help patients feel better.
Okay, one question I must ask, Constança, is how COVID-19 pandemic is affecting your disease and your entire life. Do you feel more vulnerable?
The pandemic has changed my life in many ways, starting from my personal life, if you don't mind. I've been very lucky and I've been able to be teleworking. So I haven't been in my office for March 10th, which means that I've been able to isolate myself, to leave Barcelona and to be away from everything because, as I told you before, we went to the Pyrenees and now we are in the countryside. We haven't gone back to Barcelona yet. I did during the confinement. I didn't go to do any shopping for 2 months, which psychologically is really big. I was in the mountains in a house with no one else than my husband, my kids, and so it was quite hard. But I do feel that it was the right decision because I haven't been ill during that time, and I do feel more vulnerable in the sense that I'm aware that I can have it, and I can be infected as much as the rest of the population, but I feel that the impact on me, it could be worse than in a normal, in a person that doesn't have bronchiectasis. So I feel panicked. I'm going back to my normal life in Barcelona right now, taking metros and buses, or even taking my kids to the park. I don't want to go there. I can't even think about it. So I'm pretty happy where I am now right now. But I do feel more vulnerable in that sense of that the illness can affect me, my condition harder than in other people. But it has helped me a lot in the sense that since I moved out of Barcelona, I haven't been ill during all this period.
Mm-hmm. As wearing masks and social distancing have contributed to protect us from COVID-19, but also from other viruses, bacteria, and fungus, do you think it is a good idea for patients to continue wearing masks in the future, especially in some situations such as going to the hospital or even when they are in places with a lot of people?
To be honest, I really don't know. I do feel more protected with the mask, and it certainly has an effect on, or it's a fact during a mask reduces the risk of infection. But which kind of mask should we use? And when? In which situations? I get that when all started, no one hardly knew anything about the pandemic, and all the medical systems all over the world were, and I guess still are, overwhelmed. But I would have appreciated that someone at some point would contact me and told me the difference between a mask, which one should I wear when, or should I use in every situation, since I am in a high-risk population condition, not only for me, but the whole population of high risk. I mean, I wouldn't need a call or anything, but just a general email from the health system. I get that doctors are not for that, but there should be someone in the whole health system to be sending out a mail saying, when you go to hospital, please use FFP2 mask, and don't worry, if you want to go to pick up your kid to school, you can use a regular mask, but please be sure that you're using the disinfectant gel 3 times a day, to ensure that I'm wearing the correct mask and I'm doing the correct things every time that I go out or when I'm dealing with other people, so that the public system or the health system make sure that I do it correctly, and I don't read any fake news on the media or in the internet, and I'm just having a FFP3 mask, thinking that it's better than FFP2, where it's not. And yeah, I would have appreciated. I also feel that when there was the shortage of masks, I should have received a prescription on a FPP2 mask. So I was able to get them first as being a high-risk population, not only for me, but for the whole population of high risk to getting the pandemic, and, that to have fast access to them, so I could go to the pharmacy and say, hey, I need this because I need to be first because I have a medical prescription, that could be half controlled also by the medical health system. And also maybe in a cheaper than others, maybe not at the beginning because there was this shortage, but in a long term, maybe for chronic and high-risk population patients, there should be, if we have to use them more, if we can only use them for certain hours a day, and we need, a lot of them, maybe they should be cheaper for us because in my case, I can afford it, but some other people, I'm sure they can afford it. And I think that's something to think about it. In my case, I wouldn't mind using the mask in the future because I think it helps, and mainly in places like hospitals or very crowded places. And I think for when there's the influenza also, it would help, to make sure that we are not getting in, or we have something else to help us not being infected.
Okay, thank you very much, Constança and Aurora, for sharing your personal stories with us. And thank you all for listening to us. And let's hope that the health situation begins to improve fast, and the next year we can meet all together in the next conference. Thank you very much.
Thank you.
Thank you.